Okay, a couple of items for all of you at the top. As you all know, today is Cyber Monday, one of the biggest shopping days of the year. The President will convene a roundtable shortly with CEOs and leaders of major retailers and grocers to hear about their expectation and preparation for a robust holiday shopping season. We've already seen some evidence of that over the last several days. This event will include CEOs from Best Buy, Food Lion, Etsy, Walmart, Mattel, and more. The President will also share a message directly to American consumers. Throughout the holidays, products will be on shelves and consumers will be able to purchase what they want and need. The event follows early estimates that Black Friday sales were up nearly a third since last year. In-store sales were up by even more than that, and we are hearing similar reports from Small Business Saturday. After the roundtable, the President will deliver remarks on the administration's work to strengthen the nation's supply chains, lower everyday costs for families, and ensure that shelves are well stocked this holiday season. As you all know, the President is headed to Chile, Minnesota tomorrow, and I wanted to give you a little bit of a preview of that. He will travel to Rosemount, Minnesota, to highlight how the bipartisan infrastructure law will deliver concrete results for communities, create good-paying union jobs, and position America to compete and win the 21st century. He will visit Dakota County Tech, a technical and community college that illustrates how similar institutions across the country will train the next generation of workers and rebuild America's infrastructure. The majority of jobs supported by the President's bipartisan infrastructure bill will not need a four-year college degree, and the programs provided by community and technical colleges like Dakota County Technical College will provide the training and skill development needed to help workers access the jobs created. Paired with the historic $24 billion investments in workforce development in the President's Build Back Better agenda, schools like Dakota County Technical College will prepare millions of workers with high-quality jobs in growing sectors and will help rebuild and transform the workforce. After visiting the college, he will deliver remarks on how the bipartisan infrastructure law will deliver for the American people, create good-paying union jobs, lower prices by improving the infrastructure for our supply chains. And this is also, of course, a part of our ongoing effort to go out there and tell the American people how this law, I should say, will benefit them. Go ahead.
Jen, a couple of questions on Omicron and one on the Iran talks. I know we got to wrap at 1:45.
Yeah, and we'll give you a note. We will note if he's running a little bit late and you have a little bit more time, we'll keep going.
Great,
so go ahead.
So off the top, the President seemed pretty confident Omicron is going to crop up in the U.S. Can you talk a little bit about when we might expect that to happen, how the White House will inform the public of its spread, and then I know it's going to take a couple of weeks for us or the administration to have a handle on all of the issues related to this variant. Why will it take a couple of weeks? Is the President confident in that timeline? Is he all right with that, or would he like the scientists to speed up? And then lastly, on boosters, he talked about the need for boosters. Does the White House have any plan to ramp up its promotion of boosters beyond what we've seen from the President?
Sure. Let me start with the timeline, because I think this is an important piece for the American people to understand what the process is and what the scientists are working on. So first and foremost, as you all know, we have a top-notch group of scientists across the country already set up to do this work, and they are working in close coordination with scientists and medical experts around the world. And you saw that coordination happen over the last several days. So, one of the things that was interesting to watch, I think should be compelling or encouraging, is that as soon as this variant popped up, it was communicated and coordinated around the world. That information was shared publicly in a transparent manner. That credit is owed to the South African leaders there, and certainly the President, to answer one of your earlier questions, is committed to continuing to be transparent with the American people as we see any cases come up in the United States. And Dr. Fauci and other medical experts have pointed to the possibility that will and could happen, and we will be transparent with the public and track that closely. So let me go back to how this process works. These experts, our medical experts, are primed to do the work around the clock. When you want to test a virus, you need to isolate it from a swab and purify it and make sure it is a live virus. And the virus you intended to study, this takes some days. This all takes days. Then you need to grow a stock of it to test. Again, days to weeks. And once it's grown, you have to sequence it and make sure it hasn't mutated again while it grew, again, days. And finally, you need to actually test the virus with antibodies from vaccinated people. Again, days. The last step needs to be repeated because we want to make sure we've gotten this right. Right. So that is the process that our medical team is undergoing now, because they want to be able to report back some of the important questions and unknowns at this point in time: the efficacy of the vaccines, and if any additional steps are needed to take, and we're prepared to do those. What the American people should know is that the president is going to do everything. He's going to always err on the side of protecting the American people. That's why we put in place the travel restrictions, and we will continue to assess any step we need to take in order to do exactly that. I may have missed one of your questions. Did I miss a question? Okay.
Boosters?
Oh, boosters, and whether we're going to promote these further. Well, I would say you heard the president say this earlier today, and we have had medical experts, Dr. Fauci and others, across the airwaves and out there in public over recent days to convey clearly that we know that boosters can strengthen antibodies in the American people. There are still tens of millions of people out there who have not gotten their booster. If people feel they don't know what to do right now, they're not sure which step they should take, even as there are unknowns, and we acknowledge there are unknowns we're looking to get to the bottom of, there's no question that getting a booster will help strengthen people, protect them, and we will continue to project that out publicly.
And then on the Iran nuclear talks, as they resume, Robert Malley said signs from Iran, quote, are not particularly encouraging. And Israel's Naftali Bennett said that Iran is trying to, quote, end sanctions in exchange for almost nothing. Considering the pessimism expressed about diplomacy there, how much time is the administration giving to Iran before President Biden moves on to other options?
Well, first and foremost, unquestionably, our best approach here is through diplomacy. That is the preferable approach. So I'm not going to give a timeline for when that would end. That is what we were going to continue to press forward on. In terms of rumors out there or reports about what is going to be negotiated, obviously I'm not going to negotiate from here, not that you're asking me to do that, but our objective has not changed. It remains a mutual return to full compliance with the JCPOA. This is the best available option to restrict Iran's nuclear program and provide a platform to address Iran's destabilizing conduct. That is what we are discussing. Rob Malley is obviously the lead negotiator. We're working with our European partners in lockstep. And of course, we are going to continue to press toward a diplomatic approach.
Thanks, Jen. Two questions quickly on Omicron. The president said there's more work to do in terms of how dangerous it is, knowing how it spreads. I'm wondering if you can elaborate on some specifics in terms of what is in place now, systems that are in place now. How is this going to be tracked and traced domestically in local communities across the country, whether you're working with governors, states, or is this an area where there's still more work to be done?
Well, I think what the president was trying to convey is that there are several layers of work right now, right? I just outlined for all of you the work that is being done, the scientific data analysis that is being done. But I can assure you that our public health, our officials here are in very close touch with daily and in ongoing calls with all state health officials and public health partners. Calls were held throughout the weekend with various public health officials at state and local level. These calls included state, county, city health officials, state epidemiologists, state laboratory directors, and partners for public health organizations. So that is something that was started over the last several days, and we are continuing around the clock coordination as well. The CDC is also meeting today with state labs, and throughout the week we will be engaging with state health associations in order to make sure we are in continued close contact.
And in terms of states and local municipalities, the president was asked this, but maybe you can elaborate more on whether he thinks these areas that have done away with mask mandates should reverse them given this new strain. He didn't really answer that. So does he believe that perhaps the district, other places should go back to where they were with the mask mandates?
Well, it has not changed. The guidance from the CDC has not changed, right? Which DC is abiding by and other localities are abiding by. Our advice continues to be to follow the advice and counsel of national public health experts from the CDC and others. Of course, they're continuing to assess, as you saw by our announcement over the weekend, our health officials are, any additional steps that need to be taken. So our advice and recommendations continues to be to watch that closely and follow that in order to protect your communities. Go ahead.
Thank you. I wanted to ask if the White House was reconsidering the decision to release strategic reserves, given that oil prices have already gone down with the emergence of this new variant.
We are not reconsidering, no.
And I was wondering if there was concern on the part of the U.S. government about the lack of specifics from Beijing on its part about its own reserve releases.
Again, I mean, we all are always encouraging any country around the world, including China, to be as transparent as possible in any of their policy maneuvers, but I don't have any additional concerns to express today.
Thank you.
Go ahead.
A few on Omicron and then one on a domestic matter. President insisted that the travel ban on South Africa doesn't punish them and neighboring countries, but South Africa's leaders say it does. How long does the White House envision that travel ban staying in place?
We will continue to assess it. I would say that the objective here is not to punish, it is to protect the American people. As you just heard the president say, this is not going to prevent, it is going to delay. And that delay is going to help us have necessary time to do the research by our health and medical teams to get more people vaccinated and get more people boosted. And he is always going to err on the side of protecting the American people. I would note that the difference between South Africa and European countries is that there are already hundreds, if not thousands, of cases of the new variant in South Africa, and not as many, much a lower number at this point in Europe. But we will continue to assess what steps we need to take to protect the American people.
Are you imposing any new testing or tracing on Americans or green card holders who come from those Southern African countries once they get here?
Well, we already have stringent requirements in place, as you know, a requirement of vaccinations, a vaccination requirement, and individuals need to be tested 3 days in advance, within 3 days, I should say, of traveling. I don't have any additional requirements or restrictions to preview aside from the current restrictions on travel from certain countries.
There's this trip to Minnesota tomorrow by the president. You have all said that you're going to continue aggressively traveling and selling Build Back Better, the infrastructure plan. Is there any talk of restricting his travel or his movements at all in the coming weeks?
There is none planned at this point, and obviously we can continue to assess, but we have every intention of moving forward with our plan to sell the President's Build Back Better agenda, and obviously he is a pivotal player in that.
And on Build Back Better, given that Congress is back, what's the plan this week in terms of White House engagement with the Senate? And to Republicans who say that this is something that could contribute to inflation, I think there was one Senate Republican who called him the Mad Hatter for pushing for this at a time when inflation is off the hook. What would you say to that?
Well, on the first piece, I would tell you that our team, senior White House officials, have been in close touch already over the last several days on moving our Build Back Better agenda forward. We had some of our senior officials meeting with the Budget Committee over the last several days. I think they had 2 meetings over the last several days. We had a number of our senior White House officials meeting with Leader Schumer's team last night. So I can assure you we are moving forward full speed to get this done, and we expect action on it in the coming weeks. We will continue to press for that. For anyone who's criticizing, I would say that the way, and we saw, I would say, in recent weeks, even with the votes of Republicans, every Republican in the House went on the record voting against steps that many economists have said would ease inflation. They voted to raise taxes essentially on middle-class families, voted for higher child care, prescription drug, and elder care costs, despite claiming they agree inflation and costs are a problem. So we're out there. Democrats in Congress are out there, many of them. We welcome Republican support, I will continue to say, taking steps to lower costs. We know that Build Back Better will start cutting childcare costs in half in 2022, make preschool free for many families starting in 2022, lead to the construction of additional housing units starting in 2022. What is the Republican plan for lowering costs, for addressing inflation, something they are very concerned about, but they don't seem to have any solutions for? I don't know what the Mad Hatter reference is, but that feels like it's more applicable. Very good.
Thank you, Jen. Before Joe Biden was president, he said that COVID travel restrictions on foreign countries were hysterical xenophobia and fear-mongering. So what changed?
Well, I would say first, to put it in full context, Peter, what the president was critical of was the way that the former president put out, I believe, a xenophobic tweet and how he called what he called the coronavirus, and who he directed it at. The president has not been critical of travel restrictions. We have put those in place ourselves. We put them in place ourselves in the spring. But no, he does not believe. He believes we should follow the advice of health and medical experts. That's exactly what he did in putting in place these restrictions over the weekend.
Okay, we saw the president shopping indoors on Saturday behind glass that says face covering required, but his face was uncovered. Why?
The president is somebody who follows the recommendations and the advice of the CDC. I don't know what the circumstances were of that particular moment.
He was shopping in a store, and on the glass outside it said face covering required, and we could see him inside, and his face was uncovered.
Well, again, Peter, our recommendation and advice continues to be for people to wear masks when they are required in establishments. I don't know what this establishment was. The president obviously follows the advice of his health and medical team.
Is there concern that when the president says today, please wear your mask indoors in public settings around other people, and he doesn't do that, that it's going to make it harder to get people to follow him?
I think you see the American people, and all of you see the president wearing a mask every time he comes out to an event, when he's sitting in meetings, and certainly he will continue to model behavior he hopes the American people will follow, not for his benefit, but to save their own lives and the lives of their friends and neighbors.
On immigration, Joe Biden once described the Remain in Mexico policy as dangerous, inhumane, and goes against everything we stand for as a nation of immigrants. So why is he keeping it?
He continues to stand by exactly those comments and statements. And the Secretary of Homeland Security put out a memorandum conveying we want to end this program. But we also believe in following the law, and that's exactly what we're doing, as there was a ruling that required us moving forward with implementation.
And then last one, since the president said that this administration is monitoring the situation in Waukesha closely, it has been revealed by prosecutors that the assailant swerved his truck side to side as part of an intentional act to run over as many people as possible. 6 people are dead. Some children remain hospitalized. Why hasn't the president visited the members of this Christmas parade attack?
Well, I would say first, as you saw the president convey last week, our hearts go out to this community, to the people in Waukesha, that we've been in touch, obviously, with officials there, and we're all watching as people are recovering, and this is such a difficult time of year for this to happen. It's difficult any time. Obviously, any president going to visit a community requires a lot of assets, requires taking their resources, and it's not something that I have a trip previewed at this point in time, but we remain in touch with local officials, and certainly our hearts are with the community as they've gone through such a difficult time. Go ahead.
So for the American public that knows that there's been a rise in COVID in their communities that may be related to the Delta variant, it may be part of this winter surge, if people are experiencing symptoms and they get tested, should they have an expectation that their test will be in some way compared to whatever we do know about the Omicron variant? Is there a surveillance capability for that kind of study at this point, where in hospitals, testing settings, does that exist now?
Well, so FDA is closely reviewing the performance of existing COVID-19 tests with emergency use authorization against the Omicron variant. Importantly, test manufacturers with FDA emergency use authorization are required to assess their tests as new variants emerge. And that's exactly, Kelly, what they're doing now. On preliminary review, which is what we have at this point in time, our science and medical experts believe high-volume PCR tests, which is what you get in a lot of medical facilities, and antigen tests widely used in the U.S. Show low likelihood of being impacted and continue to work. That is encouraging, but it is something we're continuing to look at. But right now, that's what our early assessment is of our health and medical experts.
So in terms of the surveillance ability around the country as cases are positive, what is the president's view of our ability to catch that new variant if the expectation is it will be here? I mean, is there a big run-up before we're actually able to do that?
I wouldn't say that. I think it's something that we are in close touch of, as I noted a little bit earlier, with state and local public health officials. We're in constant contact with them, and we will, again, as I noted earlier, be very transparent about when we see, if we see a case here at which Dr. Fauci made clear that, well, these restrictions can certainly slow. We're not conveying that they could prevent.